Welcome to Startup Health TV. I'm Logan Plaster. Today's Health Moonshot Update is with James Hare and Dr. Carolyn Lam, the duo behind Us2AI, a startup out of Singapore that's been with Startup Health since 2018. With Us2AI, formerly known as Eko.ai, James and Dr. Lam are taking the process of testing for heart disease, something that used to be siloed away in cardiologists' offices, and really opening it up to the world. To do this, they're using artificial intelligence to read echo exams. It's democratizing the whole process of testing and hopefully opening up rapid testing to millions more people, which is pretty important given that cardiovascular disease is the #1 killer in the world globally, taking as many as 18 million lives a year. Our interview starts with James Hare, and Dr. Carolyn Lam joins us halfway through as she finishes a shift at the hospital. I hope you enjoy. All right, James Hare, thank you for joining me for the show today. We've gotten to talk in the past, but I know you've got some exciting updates. So excited to dig into them for the next 15 minutes.
Pleasure to be here. Pleasure to share. And yeah, it's, well, like most startup health entrepreneurs, things are crazy busy, but for us, it's been a great couple of quarters and glad to share.
So you're the CEO, co-founder, Us2AI, and the last time we talked, the last couple times we've talked, you were using artificial intelligence to really make it easier for cardiologists and others to read echocardiograms, echoes, increasing the speed and accuracy of those readings. Is that still the world that you're operating in?
Still the world we're operating in, but we've had the opportunity to, with little baby steps, approach our moonshot vision even more in recent months. So our moonshot is really to expand machine learning capabilities to everybody, to expand access to echo and give people access to their heart health. One of the ways that we are going about that now is by expanding our algorithms to handheld devices, point of care, ultrasound. I don't know if you've ever seen one of these tools, but Logan, they are amazing. So you can take this probe, plug it into your iPhone or Samsung device, and suddenly you have the same capabilities of seeing what's going on in your heart that you would normally only get in a specialist cardiology center, et cetera. And so in the past, we'd only been working with these big boxes. Now we're going mobile, which expands access to more and more people.
That's really cool. I mean, I remember back in the days of Mobisante, I think was the first ultrasound that would plug into your phone, and that was a good 8 or 9 years ago. But it's taken time for that market to develop, and now I know there's Butterfly, there's all of this work to democratize point of care ultrasound. I actually wasn't aware that that world of ultrasound connected to your echocardiogram world. Explain to me how that connects.
Sure. So it's pretty cool, actually. You can think of, normally when we have issues with our heart, we go to a cardiology center or we go in front of one of these big boxes, they image our heart. That's the traditional approach. But now companies, like you said, Butterfly, GE with the V-Scan, Philips with the Lumify, they have these smaller devices that, literally you can hold it in your hand. I wish I had one with me now. It would have been a great prop, should have thought ahead. And what our device does is our software lays on top of their apps. So they start their app, the images are being captured, and our software is reading those images real time, processing them, and giving you, sort of doing all of the annotations, figuring out which way you're holding the probe, giving you guidance to help you get the right view, and then producing a report. So we've been doing demos with our partners recently where we literally take one of our interns, an engineer who, 1 week earlier couldn't find his own heart. And suddenly he's got, this probe using our software, and within 2 minutes, he produces a full report.
Wow.
Now, these things have to go in steps, right? Our software, we're going through the regulatory process now, and our software is geared towards cardiologists, to trained physicians. But, that's the short and the medium term. A long-term goal, like the moonshot vision we said, is to get into everybody's hands. And there will come a day when, people like us too can get access to AI to know their heart health.
Okay, so let's talk about the patient population. We've said heart health a couple times. Some people know that they have heart disease. We know this is one of the biggest killers in the world. How do you think about the patient population that this affects, and kind of put it in really normal terms? Who would have one of these? Who would want to do these kinds of scans for their heart?
Well, the simple reality is that if there was one other person on this call, 1 in 3 of is going to die of cardiovascular disease. It's still the world's number one killer. And so it's something that's applicable for everyone. The thing is, most people, they present when they have heart issues, they present to their doctors dead. And that's
Mm.
a little bit late in the game. Ideally, you'd want to know what's going on with your heart before you have a heart attack, et cetera. And that's the problem. So the way a cardiologist's first tool of choice is echo. But they're locked up in these centers, so you only get your first echo once there's a problem. Wouldn't it be nice to sort of get them earlier, track your progress longitudinally? Every couple of years get another one. We can't do it with the current paradigm that we have of few echoes that are hard to do, they're long and complicated. We need to make the whole thing easier, and with that we can do more imaging, track things over time, and get a heads up on your heart health.
Very cool. You just dropped in the brand name. You said us too could benefit from it. Obviously, we got to talk about your rebrand. You just changed the name of the company, which is a big deal. Unpack that name for me. Us2.ai. What's behind it? Why did you go through that rebrand?
Yeah. So us too, we wanted to do a rebrand that made us a bit more distinct, and a name that felt more in line with our. So us US is the acronym that doctors use for ultrasound. So anyone asking for a echo report or ultrasound report, they use US. But then the idea of us too, really getting or pushing access to this, machine learning algorithms that no one in there normally thinks they can ever access. And no, I mean, today machine learning is everywhere. You can't pick up your phone without using some sort of facial recognition machine. It's going to be everywhere and everything. And we want, people like us too to have access to this type of technology. And then if you look at the logo, we've also done it shows the waves of sonogram waves, the ultrasound waves, and then there's a little red dot at the top that not only represents the heart, but is representative of Singapore, where we're based, the little red
Gotcha.
dot.
There you go. Has that been a challenge? I mean, renaming, rebranding comes with its obvious logistical challenges.
Fortunately, we did it early enough in the game where it wasn't so challenging. I might have missed out on a few emails, so please excuse me. But other than that, it was fairly smooth. Thanks.
Awesome. You've got some really interesting partnerships. I believe it's AstraZeneca and Roche. You're working with some of the biggest pharmaceutical companies in the world. And I actually have had the opportunity to talk with some of your counterparts at both of those companies. And their excitement over what you're doing is it's kind of amazing. You're in an envied position in that they are clearly seeking out what you're doing. What is it about? I mean, you're a startup. There are these multinational pharmaceutical organizations. What is it about what you're doing that is so novel that Roche and AstraZeneca are just so excited about it?
Sure. So we now have 4 deals with pharmaceutical companies. So the 2 that you mentioned, AstraZeneca and Roche, but also Johnson and Johnson and Bayer.
Wow.
And they've been phenomenal partners for us. All of the deals started, our first deal, we released our first commercial product for the research and pharma market at the beginning of this year. And things have been wrapping up since then. One of the surprises of this COVID era, where we happen to be lucky enough in an industry where things are actually improving and the pace of development is improving. One of the things that they see in us, I think, is that, well, frankly, the first thing is I should mention, we see and are learning a ton from them. That's the first.
Sure.
These are amazing partners, and the
Sure.
learning goes both ways. But these are companies that have therapeutics for diseases
Okay.
that are hard to diagnose. And they're looking for companion diagnostics. They're looking for tools that can help people detect these diseases early in the day. Can you let Carolyn into the call?
Hi, Dr. Lam. Apologize for any inconvenience. Um, if you democratize the process of discovering you have the issues, then you can get the therapeutic sooner. You get the Roche, the AstraZeneca product because you're jumping on it earlier in the process. You're not waiting until it's emergency, waiting until you're heading into the ER with a heart attack. Is that right?
That's absolutely correct. And there are a number of ways of doing this. One way is, our algorithms can troll through images that patients have in hospital settings, just trolling through databases to pick up the cases that might have been missed. There's the that we discussed earlier, of mobile point of care. So getting these mobile devices into the hands of general practitioners with our software, because the reality is, when these devices, the more they spread out and get into people's hands, they're getting into people's hands who aren't necessarily the expert trained cardiologists like Dr. Lam here, right? And so the more people that have these devices, the more help they need interpreting the images. And so the more important it is to have machine learning and software.
Uh,
And
Dr. Lam,
maybe
oh, go ahead.
from a medical point of view, it's actually quite a critical need. For example, for a simple condition like heart failure, which is the commonest cause of hospitalizations among the elderly in the whole world, costing billions of healthcare dollars utilization. It's a very common condition, and its diagnosis depends on an echocardiogram, seeing that the heart has weakened.
Yeah.
This diagnosis is missed in 1 in 6 patients presenting to a general practitioner. And it's because the symptoms of having heart failure is breathlessness. And these poor patients usually get, classified as old and deconditioned and just breathless and unfit. And if they had an echocardiogram, they'd immediately see that there's heart failure. And it becomes all the more critical because there are effective treatments that actually keep patients out of hospital. We have them. And we're not making the diagnosis. We're only making the diagnosis when they land up in hospital. So that's one a big thing. And then even among people who get echocardiograms, there's a condition known as pulmonary hypertension, where it's not the left side of the heart, the part we usually look at. It's not the problem of the left side of the heart. It's a problem of the right side of the heart. And so untrained, even cardiologists can miss that very, very often. And this is a deadly disease unless it's treated earlier. And again, we have effective treatments. So it's a really big problem, not just, in terms of common diseases, rare diseases that get missed. I could go on and on with examples. But industry is also really interested, not just in early diagnosis and just for their medication, but also sometimes they perform trials that show that maybe certain groups of patients only benefit. And in cases like that, the echocardiogram, and especially there's AI, may be able to see the patterns that human beings cannot see of who may respond better to a certain medication than others.
Interesting. You started to paint the picture of this sort of future where these sorts of tests are more democratized, and your AI, your technology is paired with hardware, a cheaper, more accessible ultrasound machine. And I know that is sort of a future vision that's been mirrored in other industries as well. Just ultrasound in general has been talking about that democratization of at-home testing for a number of years. And I wonder, what do you see as the kind of the steps towards that future? There are logistical, operational, cultural barriers between here and there. This idea that more of us have these things in our hands, we're doing tests. What do you think needs to happen over the next few years um, to get there, really?
So first of all, Logan, I think you're spot on. Frankly, if we would be honest with ourselves, we're facing a Kodak moment
Mm,
in ultrasound. It is ripe to be disrupted. Why? Because ultrasound's so safe. If it's something we can point to an unborn fetus, it's so safe, and it's the only modality that you can do that with. You can't bring an MRI machine home. You can't bring a CT with all its radiation anywhere with you,
yeah.
but you can an ultrasound. So what are the steps? Well, first of all, I think that we need specialists to kind of eat humble pie and realize that a lot of what we're doing is actually trainable.
Mm,
It's recognizing things, pictures, it's tracing out lines that maybe even AI could do better than us in some cases. And then perhaps realizing too that what we're aiming for not a self-driving car in ultrasound. And perhaps the best marriage of it is you could do a bit of screening, but then at the end of it, if there is a screening that suggests something's wrong, you need a doctor to have a look. Or in the first place, we need someone to just have a quick look over things. So acceptance is one of those big hurdles. And then, of course, if we really integrate with very, very mobile hardware, that's another, we need to integrate with very mobile hardware. We're only software, right? So that's another hurdle that needs to be overcome.
is that hardware, is that coming to fruition? Do you feel like where do you feel like we are in the evolution of the hardware?
I, I don't even need to guess there. It's literally happening in front of our eyes.
Okay.
So there is a probe that can, be connected to your smartphone right now, and we can look at the heart. Now there were limitations because the hardware becomes shrunken so small, and there have been limitations whereby only a certain modality of echo, two-dimensional, can be done. But now there are newer probes where it's not just the two-dimensional, but this other modality called Doppler and flow, which the big machines could do and these small probes couldn't. Now it can be done. So it's literally leaps and bounds. And we've seen another probe now that's wireless. So it's Bluetooth.
Wow.
So
Wow.
now you don't even need the wire to talk to your smartphone. I don't even need to guess there. I can see it happening. It's amazing.
Wow. And James, I mean, your experience prior to this was more in consumer entrepreneurship in operational sort of large scale operations. Like, where do you see this? Where do you see some of the challenges in terms of just reaching people, educating people, et cetera?
I mean, yes, it's a significantly different industry than the one I came from. The biggest challenge, of course, is the regulatory hurdle. We are, it's something that all companies like ours must go through and face. Uh, and it's a good challenge to have, frankly. We want our products to be regulated. We want third parties signing off on the safety and efficacy of our devices. But it's a significant challenge. That said, there's also, we've had conversations with regulators many times now. There's a strong demand for this stuff. I mean, the need is clear. Everyone sees where the future is. It's just, proving that you are the one who can provide the solution. So we're going through the regulatory process now in the U.S. and Europe and China all simultaneously. It's, it's something that a challenge we have to meet, but it's kind of fun too. It's the test to prove ourselves.
Yeah, with those challenges come opportunities. Who else can face them in the same way you have? I'll close up quick because I know you guys were in Singapore and it's getting late over there. I feel like among the hundreds of companies within the startup health portfolio, for some, the COVID-19 lockdowns were a real slowdown, and for some, they were a real shot in the arm. How would you say that this reframing of health around remote care kind of affected your business over the last 10 months?
We frankly, well, it's quite funny because in the past, having run businesses during, 9/11 and SARS and the dot-com crisis, when COVID hit, I immediately hit the brakes on everything and became the most conservative small business you could possibly imagine, right? Just being ready to survive the fallout. But all of our partners began sending signals that we need to do the exact opposite. They were engaging faster, they were getting more ambitious, and so we had to hit the accelerator pedals. We had to, go from retrenching to suddenly hiring more. And already we're meeting our next year hiring targets this year. We exceeded our budget targets. So, we're frankly very fortunate. It's a secular trend that's going our way. And just like, we're not the only ones, the COVID crisis has shown multiple industries are winning, the internet business, anything bought on the internet in general, home delivery visit, all these businesses, everyone's gaining years in the course of months, all of a sudden. And we're following that same course, fortunately.
If I could be specific from the medical point of view, I've never seen cloud-based solutions and remote monitoring solutions so embraced. To a hospital system or clinician, we get an anaphylactic reaction, right? And conservative people go, no, you actually have to touch the patient's hands. And I'm not saying that is out of the window, but at least people are open now. In fact, needing a lot of these remote tools. That there's a name for it now. It's called POCUS. It's point of care ultrasound. It's a thing now. And COVID has advanced POCUS. That's us.
It's got its own hashtag on social media. Hashtag. Well, Dr. Lam, I'll give you the final word. What benchmarks are you most excited about hitting in 2021 with Us2.ai? What's on the horizon that gets you the most excited?
No brainer. First, regulatory approval, starting with the US, but also including Europe and China, Singapore. Nice. Number two, getting our peer review publication. That's really in a mature stage now. So that's sort of getting the word out in my little academic community and hopefully turning skeptics into believers. Third thing, actually seeing this being implemented clinically. And we've already got sort of ethics approvals and trial protocols all set up to do these point of care echoes, to compare it with standard echoes, to look how much efficiency our software adds to the standard process, and to even test if untrained individuals can now go into the community and use our software to do screening. I'm so excited about those things.
That's going to be amazing. And I just feel like it's the tip of the iceberg. I mean, this is just one application of the AI and the machine learning, one application of the hardware, and we're just moving into this new world of more democratized at-home testing, earlier detection, et cetera. So very, very exciting. Well, Dr. Lam, James Hare, thank you so much for the time. Appreciate you staying up late there in Singapore to do an interview with me. And even more so, excited for the work that you're doing in 2021 to bring this kind of care to the folks who need it most, to millions who suffer from heart disease and related conditions. So thank you so much.